know IQED, our mission is to deliver technologies that are improving both outcomes, but also are saving time and saving money. And we set out that company because the environment has changed in ophthalmology, right? Reimbursements are going down, costs are going up, there's a shortage of ophthalmologists, there's a shortage of staff. Now, from your point of view, what role does technology play in addressing these problems?
Yeah, I mean, if you take a step back and you look at where we are in 2026, you have a growing aging population. And the need for eye care is growing with that aging population. And the finances behind healthcare are staggering at this point. You look at end of care costs, that pie is not getting bigger, it's just getting divvied up in different ways. And unfortunately, ophthalmology is getting the short end of that stick. You look also at our workforce, and we're not training a bunch of new eye surgeons. The number of residency slots is pretty static, it's not increasing. And then you look at the actual ophthalmologists out there, there is an epidemic of burnout amongst physicians, specialty agnostic. So a physician that might have worked into their 70s before, now they want to get out at 50 and 60. And that burnout can manifest in different ways, cutting back number of patients they're seeing, retiring early, or going into a different sector altogether. So it's the volume of patients is going up, the number of providers is going down. And I think part of the issue with burnout as well, there have been lots of studies about it, but what we've set up in these structures here in healthcare, modern healthcare, is there's so much between me and the patient. The EMR, the technology, the phone systems, I mean, it's all not geared to connect the provider to the patient. And I think that leads to a lot of burnout.
You're also known for adopting new technologies. What does that process look like usually? What does it take for you to adopt a new technology?
I mean, new technologies look at several things. Number one, is it going to make a big difference for my patient? Is it going to improve my workflow? And then the third part of that equation is how much is it going to cost? How is that going to affect the bottom line? And all three really need to be in alignment. It's hard to do anything with one of the three checked off. Like if there's a workflow, but the outcomes aren't better, or it doesn't improve the finances, and it's hard to implement a change like that. If you have a workflow that doesn't improve the outcome, so on and so forth. So really have to try to line up all three for it to be worthwhile to change the processes in our clinics.
Now you mentioned workflow. What is the main bottleneck right now when it comes to workflows in your clinic?
There is a lot of bottlenecks, unfortunately. You try to fix one, you think you fixed the whole thing, and then, the other one manifests itself. But it's everything from intake of the patient, how the patient interacts with our clinics, how they get scheduled, how they check in, how that patient gets to my technician, all the things that have to be documented by the technician, ancillary things that are not really pertinent to my care, but medicine reconciliation and lots of other check boxes that have to be done. You look at another bottleneck, which is all these diagnostics, disparate systems, and each one has a different input. I have to put the name, medical record number, and date of birth. And then that has to go into a cloud. And then you have duplicate entries, and I can't resolve those entries, and I can't track my patient, I can't get the right data. It's frustrating. And as a physician, you've got to weather all of that, and you have to synthesize all that information, and you have to make a plan for the patient. And taking that from the check-in to diagnostics to the operating room and then the post-op, it takes a lot out of a physician, a provider, and you can understand why burnout is increasing amongst our workforce.
You mentioned fragmented diagnostics, right? Many different devices, different data formats, you have to piece them together somehow. What would the impact be if those were combined in a single device?
Well, you look at old world ophthalmology, right, where there's a lot of fat, right? There's lots of patients, and they are willing to pay, and you have great compensation. So we're willing to buy 3 or 4 or 5 devices to be able to deliver a product to the patient. And now you look at new world, which is, reimbursement's going down. I don't have that trained staff that can intuitively, take a patient and do all the diagnostics and put it in organized fashion. So we're really hampered in delivering care to our patient population.
But patients increasingly expect great outcomes when it comes to refraction, right? Refractive outcomes. What role do you see diagnostics play in that?
I wish it were just a matter of great outcomes. They want it now, and they want it perfect, right? So it's we're in in an era where it's Amazon same day and it is Uber Eats. I call them and they deliver within an hour. You know, it's instant gratification, and it's very challenging for the provider, and the patient expectations are so high. It's hard for them to deal with something that might need a little bit of work. So the ability to consistently hit the target is super important. Making that workflow seamless for the provider is super important, and making it consistent is super important.
Where do you see IQity help with that?
Well, I mean, the idea of the IQ universe is key to the whole. It's a linchpin of IQity. All of these devices that are being developed, whether that be the diagnostic setup with the IQ meter, or that be the operating microscope in the OR, or it be the headset, or it be the ECP. The ability to take all that information up into the cloud, churn it, digest it, analyze it, and then come back to me on my interfaces with nuggets of information that I can take and use for my patient's benefit.
You mentioned a lot of our technologies already. Is there a specific one that stands out for you, that you're looking forward the most?
I wish I could tell you there's one specific one. They're all very exciting. I mean, I'm not a glaucoma specialist, but even the IQ Flow is super exciting for me. Having the ability to do endoscopy in the eye for complex anterior segment surgery excites me. The microscope, I'm somebody who suffers from neck pain, so the microscope is super exciting to me. There are many of my colleagues who've had neck surgery already. Lower back pain is a big problem amongst ophthalmologists. Hip pain is a problem for ophthalmologists. Figuring out the ergonomics in the operating room is key. I mean, that is super duper important for the longevity of these physicians that we're training. You imagine we invest all this money in residency training, right? It costs a lot of money to train these people. Fellowship, and then they get into practice, and they are training still. The first 4 years of practice, you're still learning. And they get to that point, and then they have a physical ailment from their profession, and then they can't continue. That is a huge loss to us as a society. So we need to figure out the ergonomics in the operating room and in the clinic. I see the microscope from IQity as being a huge leap forward. Why do I say that? There are lots of heads-up displays out there. And Zeiss has a product, Alcon has a product. I played with Alcon's product before they acquired it, right? So you're sitting there with a little headset and you're looking off to the side and you're very uncomfortable. You've taken a problem now from me looking through a microscope, now I'm looking to the side and operating. It's just a different kind of neck pain. There are solutions out there with the heads-up displays and the large screens. I personally don't find it to be intuitive operating off of a screen like that. The beauty of the IQity microscope is you're taking the form factor of the microscope and making it more usable. So you are still grounded on the patient's eye through that microscope interface. The beauty though is that I don't have to be right on top of that microscope. I have a lot more leeway back and forth, side to side, up and down, so I can find a position that's more natural for me and not uncomfortable. So that's the microscope. The microscope also, there's so many benefits to it, right? So we have a digital microscope here. There's no lag, right? There's no perceptible lag in the system. What does a digital microscope do? Well, you get that information in video format, and we have a lot of AI and other things that can be done on the back end to enhance that image for you. So imagine you need 100% of light to operate currently. With a digital microscope, there is post-processing that can be done. So I can operate with 5% light, for example, right? And still get the view that I need. So it's a better patient outcome, a better physician experience. I just think it's what is needed in the market at this point. You look at the diagnostic box, and it's so frustrating now how all these different pieces of equipment don't talk to each other. Right, so the OCT doesn't know what the pentacam is doing, doesn't know what the biometer is doing, and you have these very cumbersome cloud-based systems that are now trying to sit on top of all that, and you have these DICOMs that are flowing into them, and then it's trying to, put all that data together in a way that I can process and use for my patients. What we need is somebody to simplify it all. Now, if you have all of those diagnostics under one hood, the OCT, the topography, tomography, the biometry, you get retina imaging, you get glaucoma imaging, you have anterior segment imaging, you have OCT of the cornea. That's very powerful. How I take that data now and it goes seamlessly into my microscope. That changes the dynamic completely. The amount of time I have to spend on the front end collating this information, digesting this information, and making a cogent plan for my patient goes down dramatically.
Where do you see the gaps for young ophthalmologists, since they're obviously a new generation, they're a lot more digital, right? They're Gen Zs that you're working with. Where do you see iQity help teach them specifically that they're more digital natives, they're more used to working with tools that will do exactly what they want at the right time?
Yeah, I think that's the key. They're used to, I click my TikTok video, it comes right away. It's just, 30 seconds in length. I go on to the next video. I'm not saying anything bad about Gen Z. It's just, this is what we're all living with, right? So I think iQity is going to be just-in-time information, right? I get the data as soon as the scan is done. It goes into the cloud and it generates interfaces for me that are meaningful, and I don't have to keep digging and looking around for the correct information. I think it's going to be what the next generation needs in meeting the challenges that are coming down the pipeline with the growing population of aging patients and decreased reimbursement.